Do
Yes.
record. There you go.
All right. Got it. All right. So, hi, Naomi Catrone. How are you?
I'm terrific. How are you, Dr. Barry Roberts?
I'm doing good. Glad you had a little time to spend with me today. Um, at Just taking a moment out of your day, a moment out of our day to really talk about something I find pretty important because it comes up a lot in my patient conversations, postpartum, especially talking about engorgement. So, as the doc who listens, as Naomi Catrone, milkdiva.com, the two of us getting together to talk about this important topic, I thought would be a cool way to circle back at the end of this month because I started at the beginning of the month talking about breastfeeding week. And so circling back seemed appropriate. What do you think?
Absolutely.
And with engorgement, the patients will come in and they'll talk about how painful the breasts are. They're lumpy, bumpy. Sometimes they'll spike a low grade temperature or low grade fever overnight. And they want to know, they need help. And like, what do I do? So I know some things I say, but I'm going to step back into my lane and I'm going to come into your lane and say, when is engorgement most likely to occur post delivery?
Well, I appreciate you tossing the ball back in my court. There's a lot of misinformation out there. And so engorgement is most likely to occur day 3 to 5 after delivery, but it can happen
Okay.
as late as day 9. But generally speaking,
Got it.
usually day 5 is like the magic number where people are really feeling it.
Okay. Gotcha. And what are some do's that may help?
Ice,
Okay.
cabbage, and lymphatic drainage or gentle massage up to the axilla. So we're not massaging forward.
Okay.
We have lots of edema
Okay.
and third spacing. So gentle
Okay.
massage, the way you would maybe pet a cat, nothing more firm than that,
Mm,
up and away
okay.
into the axilla.
Okay. All right. That's really helpful to know. What are some don'ts that are likely not to really offer much relief to the patient?
Vigorous massage, like this is what I hear a
Okay.
lot of people
Okay.
doing or see a lot of people doing.
Okay.
Pumping on high settings doesn't usually help at all. It makes it worse.
Mm,
Um,
okay.
and heat, we want to stay away from those 3 things. Not saying that
Ah,
pumping is not appropriate.
yeah.
It is, but not that high suctioning, and that should not be your primary form of trying to relieve the engorgement. The
Okay.
primary form should be hand expression.
Got it. Got it. Got it. And does engorgement decrease the chance of being able to successfully breastfeed?
That's a great question. I'm going to say right off the bat, no, not at all. Engorgement is actually a great
Mhm.
sign that your body is doing what it's supposed to do. However, if engorgement is not relieved, it could
Okay.
absolutely reduce your body from making a full milk supply. So we just can't walk around
Okay.
with engorged breasts without reducing that inflammation and pressure.
Sure.
Otherwise,
For
that
sure.
could affect long-term milk supply.
Understood. So, in addition to kind of what I try and tell patients and what we all talk when we talk about breastfeeding is saying, hey, don't give up. What would be your top 3 things that you would want someone to know about if they are faced with engorgement?
Ice is your friend. Gentle massage.
Okay.
Um, don't be afraid to pump, but I would rather you learn how to hand express. And there's a wonderful resource
Mm,
called firstdroplets.com that
okay.
can really help.
Okay.
So hand expression, coolness as opposed to heat, and gentle, like you're petting a cat, massage up into
Okay.
the armpit area are my 3 like major takeaways.
I appreciate it because I don't think anything that you've said today has been reiterated from me to my patients in that way and simplified in that way that they can wrap their heart and hand and head and brain around, that are very doable things. So I have benefited. I know anyone listening today, to us will benefit as well. And I want to just wrap up, and say thanks again, and encouraging anyone listening to us to get out, get the help you need. Is it your doctor? Is it a doula that has some lactation training? Or is it a lactation consultant like you, Naomi, at milkdiva.com? And so we keep kind of we've said some things a few times so that it will hopefully sit in your head, not just go floating in the wind. All right. We're not spending our time today to have it float in the wind. We're spending our time today to bring knowledge to you that maybe you didn't have before and say, thanks for listening. Naomi, thank you. Is there anything else you'd like to share with us today?
I would say that getting help with engorgement with our practice can be really easy by just setting up a virtual consultation. We can
Uh-huh.
handle a lot of things virtually for engorgement because it usually is the kind of appointment you need now, not in 2 weeks.
Got it.
And then
Yes.
in the spirit of breastfeeding month, the last week of the month is Black Breastfeeding Week. And so we will have a podcast
Okay.
discussing the importance of Black Breastfeeding Week. So you can just look in your
Okay.
podcast player, just type in Milk Diva, and that episode will come up on August 9th, I believe, 9th or 10th, it'll be released.
Awesome. Thank you again so much. I think we'll end here. And thanks for listening. Doc Who Listens, Dr. Crystal Roberts.
Thank you.